Hello and welcome. My name is Chris Mautner. I'm the social media producer here at PennLive, and I am here with Lynn Keltz, the Executive Director of the Pennsylvania Mental Health Consumers Association in Harrisburg. And we are here today to talk about Obamacare enrollment because the deadline is coming up. And if you have a question, if you have something you want to know, feel free to please type it in the comments. But Lynn, I wanted to start with, can you tell me a little bit about your organization, the Mental Health Consumers Association, and what they do?
Sure. We are a nonprofit organization. We have a state presence. We have members who we represent, and we are very concerned about policy that affects people with mental health needs and their recovery. We do policy advocacy, we do information referral with individuals, and we have a pretty good presence with state government. But we applied for a grant with the Centers for Medicare and Medicaid Services so that we could provide health insurance navigator services to people, to anyone, whether they have a mental health need or not. But this was the first time that people with mental health and drug and alcohol needs could be assured that they would have treatment through their insurance provider.
Okay.
So we joined in.
So let's start by talking about what is the deadline. I know it's coming up soon for if someone wants to sign up for the Affordable Care Act, or Obamacare as it's commonly known, for the coming year 2018. How much time do they have?
They have until midnight, December 15th.
Okay, so that's coming up pretty soon.
Very soon, yes.
What are the ways people can sign up if they want to?
They can sign up themselves on a website, healthcare.gov. I would caution people to make sure they have the right website because there are some lookalike sites that have more agents and brokers, and that's not the sites you want. You want
right.
healthcare.gov. It's a fairly simple process if you're used to filling out forms on the computer. You can also go to their phone number and call in and do it by phone. That's a toll-free number. And if you need additional help, you're not sure what product you want to buy, you can call a navigator. There are navigators throughout Pennsylvania, and we're available in just about all of Pennsylvania, so we have a toll-free number too.
Okay, and questions. What do you do if, by chance, you should miss the deadline? Let's say you didn't see this informative video, and you just the 15th comes and goes, and you didn't get a chance to sign up.
And you're out of luck until next year when they do open enrollment, which will probably start November 1st next year.
So there's no grace period. There's no exceptions.
We don't anticipate any exceptions this year. No. In the past, open enrollment lasted till the end of January, so people really need to be aware that it's only until December 15th. The only way you can get insurance after that is if you have a life event that makes you eligible for a special enrollment period.
Who can buy on these exchanges on health?
Anybody can purchase insurance through the through the marketplace. It doesn't matter how much money you make, but if you make less than, say you're a single individual and you make less than $16,500, the marketplace would tell you that you're eligible for Medicaid insurance in Pennsylvania. Okay. Which is a very good insurance plan for people with low incomes.
So what are some of the biggest changes this year to the ACA and Obamacare? What are people maybe who were signed up before should know about signing up this year?
People who were signed up before may get a letter from their health insurance company telling them that they're going to be enrolled in such and such a plan for X amount of dollars. But that amount of money that they're being told does not include the tax credits. So a lot of people are getting scared when they see that from their insurer. They've called us and said, why would I have to pay $800 this year when I was paying $200 last year? Right. But that's because the insurance company doesn't factor in the affordable tax credits for people with reasonable incomes. So that is something that people need to look out for. Also, people are worried because this administration at the federal level took funding away from the insurance companies that helps pay for insurance subsidies and cost sharing, but the insurance companies are still required to do that. So everything that was available last year is available this year. There's still good insurance available at reasonable prices. And the Pennsylvania Department of Insurance worked with the insurers to do the best possible things they could for the consumers who need insurance.
Where do you go if you live in Pennsylvania and you want to sign up? Can you go? So is there someone there in person? What should you do if you need help enrolling? You mentioned we kind of touched on this already, but let's go back a little bit and talk about that.
Okay, we have a toll-free number. It's 1-855-274-5626. You can call that anytime, and it'll get you to the 3 offices in the state that we have: Western, Northeastern, and Harrisburg. We will talk to you about what your needs are. If you're close to our office, you can come to one of our offices. If you can't get to our office, we'll make arrangements, hopefully, to meet you somewhere, like in a public library or a Career Links office, to help you with your insurance. We all have laptops that are encrypted and safe to use, so we take them with us to enroll people.
And for those of you just joining us here who are just started watching this, my name is Chris Mautner with PennLive, and I'm talking with Lynn Keltz today. She's the Executive Director of the Pennsylvania Mental Health Consumers Association in Harrisburg, and we're talking all about Obamacare and the Obamacare deadline, which expires on December 15th. I wanted to ask you next, by law, do you have to have health insurance next year? What if you just don't?
Okay. Number one, if you don't have health insurance, you're taking a big risk with your health and with bankruptcy. Medical bankruptcy is the biggest reason for bankruptcy in this country. But if you do make that choice, you will have to pay a penalty if you don't have any insurance, or if you're insured through something that is not considered by the law a quality health plan. So that would mean a penalty of 2.5% of the household income, the tax household's income, or which can be $695 per adult, $347.50 per child. Whichever one of those is higher is what your penalty will be. And there is a maximum of something over $2,000 that you would have to pay.
Okay. When you talk about healthcare bankruptcy, like how common is that, and how easy is it to fall prey to that if you don't have insurance?
Well, I'll give you an example of someone who came to our office this year. Before the Affordable Care Act went into effect, this person was uninsured and had to go in the hospital for a medical emergency. I don't know if it was a heart attack or something like that.
Right.
And that's very costly. I mean, hospital stays and medical care are very, very expensive.
Right.
And if you don't have insurance to help you pay for that, it's all on you. So this person experienced bankruptcy. He lost the home that he owned. He had to sell cars to help pay off the debt. He's still paying off the debt, and this was several years ago. And he lives in the basement of one of his family members. He's sold everything he has except for a few tools. So that's what you could be facing if you have to go bankrupt because you don't have insurance. It's a very big risk.
When does coverage begin? If you sign up for it, when does it officially start?
It starts January 1st, as long as you have paid your premium, your first premium.
And it lasts till December 31st?
Correct.
When someone comes to you, or when someone goes online to sign up for Obamacare, what paperwork should they have handy? What should they have with them so they're ready to go and they can get it done?
Right. But even if they're doing it themselves online, it would be good to get your paperwork together. If you have any type of immigration papers, you're going to be asked what the numbers are on your green card or whatever, your refugee settlement, whatever those numbers are. You will be asked for proof of legal residency in the United States. You should know what your income tax return said last year. So if you're going to one of our offices, you would bring that with you, and your 2 most recent pay stubs. They base next year's cost on estimated income for next year, so you have to base that on what you've had this year and last year.
Okay, so they're looking ahead at an estimate of what you're going to be making in 2018.
Right, and you also have to know the Social Security numbers of everybody in your house who's going to be on insurance and their birth dates.
Okay, so not just you, but all the members of your family or anyone living with you that you are who are your dependents.
Correct.
There's been a lot of talk, and I'm seeing in the comments on our live post here, people talking about the high cost or the prices going up. There's a lot of talk about how rates have gone up. Is that across the board, or is that just for certain categories of insurance or consumers?
I think that the people who are going to suffer the most with high costs are those people whose incomes are high enough that they don't get any tax credits.
Okay.
Okay, so, but we have seen people come in, working people who may have an income of, say, $30,000 a year and have a couple children. they are getting very low premiums because of the tax credits. The tax credits go up as the costs go up.
Okay.
So most of the people who have had tax credits before are either getting as good a deal, a better deal, or almost as good a deal as last year. I mean, it's not a bad thing for people. But those people who have an income of, say, over $90,000 with a family of four, they're going to pay more.
What about, say, 50, 60,000 with a family of four, somewhere in the middle range there?
I believe they still qualify for some degree of tax credit.
Okay.
You almost have to go in. If you go on the website, healthcare.gov, there's a can't think of the function, but you can find out before you fill out the application what you're looking at in terms of insurance and costs.
For those of you just joining us who are just watching us right now, my name is Chris Mautner with PennLive.com, and I'm here with Lynn Keltz, Executive Director of the Pennsylvania Mental Health Consumers Association in Harrisburg, and we're talking about Obamacare enrollment and the deadlines, and the deadline is December 15th? Not 5th, that was yesterday. 15th. Is there any chance people can lose their coverage anytime soon? I think there's a lot of concern about that. People under coverage, especially with all the turmoil in Congress that's going on and discussions of ending Obamacare. Is there any reality to the fear that coverage will go away?
We believe that everyone who signs up for coverage in 2018 will have coverage in 2018.
Mm-hmm.
I wish I could give a better answer for what will happen after that, but this has been good insurance, and I would hate to see everyone lose their insurance who has it now.
Right.
But if you sign up now, you will have insurance for the whole year of 2018.
Right.
And we'll take it from there. See what happens.
What are you seeing locally? Are people signing up as in the past? Are you seeing more people sign up, less?
I'd say we're seeing about the same number locally up in the Harrisburg area. I think up around Scranton, they've done a lot of outreach and have had some colleges involved in outreach, and they're very busy. We have fewer navigators because the federal government took away some of our funding to help to pay people who help people.
Mm-hmm.
So we're kind of rushing to keep up this year, more so than in the past.
And we talked a little bit, like, with what's going on in Congress this year with the tax plan that's coming out. I believe one of the Senate plan, I think it is, has a discussion of maybe removing the individual mandate, or there's been some talk of adding changes to Obamacare in the tax plan that Congress might be passing soon. Do you have any concerns about that? Do you know how might that affect people's health insurance for 2018 and beyond?
I don't believe it will affect their health insurance for 2018 at all.
Okay.
And it remains to be seen what bill actually goes through, and I can't predict what that will look like.
What is the biggest message you would like to get out there for people watching and for people who might be thinking about signing up? It's
really worth taking a look at this insurance if you haven't used it and you need it. You can go to healthcare.gov and look at See Local Plans. That's what or See Plans Now. Go to that and say See Plans Now. Type it in the search bar, and you can see what you might pay for insurance. It's good insurance. It's accepted all around the area, all around Pennsylvania. We all should have insurance. We don't know what tomorrow's going to bring, unfortunately. And for the most part, you're going to find it affordable. There are times when you can file an exception if you've had a really difficult year to get out of the exemption, to get out of the penalty. But most people are going to find that they can get insurance there.
And once again, your organization is specifically designed to help people with any questions or problems about signing up for Obamacare.
Yes, and there are other navigator organizations too.
But again, the Pennsylvania Mental Health Consumers Association, Harrisburg, where can they find you on the internet if someone wanted to contact your organization?
Our website is pmhca.org.
Okay.
Short for Pennsylvania Mental Health Consumers Association.
Okay, well, we've been talking with the Executive Director of Pennsylvania Mental Health Consumers Association, Lynn Keltz, about Obamacare. If you have a question or concern, feel free to put it in the comments and we'll try to get to it later. Thank you very much for joining us.